Welcome back to Body Beautiful. We are talking right now with Dr. Elizabeth Lee about safety in cosmetic surgery. We'll be taking your calls with any questions. The phone number, 800-440-4884. We'll also be posting the number for the doctor during and at the end of the segment. Remember, any advice we give you today, you want a second opinion. Always. We can't say that enough, and certainly at the top of the show, we really wanted to just establish, and I say we, you, it's very important to you. And,
yeah, it really is. I think that there are a lot of things that can go on that place the public at risk. And what it comes down to is being an educated consumer and knowing who is doing your surgery and who is doing your injectables and what their training is.
Okay, how do you find out?
It's a difficult question. And in the last segment, we were kind of talking about dentists and the Donda West law. And I don't want to knock dentists. I don't suppose that there are very many of them out there doing breast augmentation in their own office ORs. But the fact is that legally they could. And where we see an extension of this in medicine is that when you do a year of training after you graduate from medical school, you sit for your National Medical Board Examination Part 3, and you get a license to practice medicine and surgery. You can open an office OR and do surgery even though you have no training in surgery whatsoever. Legally you can. Okay. It's not recommended.
So you want to make sure
you want to make sure that your physician, before you have aesthetic surgery, is board certified, and you want to make sure that they're board certified in a surgical specialty, particularly by the American Board of Plastic Surgery, because they can call themselves board certified and be internists and still be doing surgery legally.
Do your homework.
Do your homework.
All right. Let's take a couple calls here. Yana from San Francisco, good morning. Do you have a question for Dr. Lee?
Yes, I do. I'm considering having some facial surgery, including having my eyelids fixed a little bit and nasal labial folds softened a little. And I wondered how much time I should allow before an event that I'm going to appear at.
Okay, Yana's asking, we're working on some audio fixes here. She's got an event coming up. She wants to do something in her nasal labial folds, and she wants to do something with her eyes. How long is it going to take her to recover?
That's a great question. The rate limiting factor for having anything done quickly is whether or not you develop bruising, because bruising can take as long as a bruise takes, and that's usually up to 2 weeks to resolve.
Okay.
So
how do you reduce the chances of bruising?
It's very difficult, but we generally say don't take aspirin, don't take fish oil, stop all your herbal remedies for at least a week before the procedure, and then it really depends on you and on the skill of your injector.
And again, if I'm hearing something about, she's saying it would sound like fillers in this area. It sounds
like fillers.
But then she's talking about her eyes, and if it's a lid lift or something,
well,
that's going to take
surgery takes longer to heal from. But if it's something that can be done with injectables around the area of the cheek and the lower eyelid, then again we're back into worrying about bruising. But if it involves something with the upper eyelid, it most often involves surgery, and that takes longer. And I would recommend a month if you have it.
Yana, hopefully that answered your question. Let's move on to Tammy from Santa Rosa. Good morning, Tammy.
Good morning, doctors. I have a question. I had a breast augmentation done about 3 years ago. And 6 months ago, they started getting very hard. And I'm really nervous. I don't know what to do. I don't want to go back to the same surgeon. But I don't know what to do.
Okay, so Tammy had a breast augmentation. She's got some complications. It's getting hard. What do you want to get a little more specific?
No, that's okay.
I mean, it's very hard. You can actually see
the implants.
Not a natural look anymore. They look like two softballs.
Right. It sounds to me like what you have happening is what we call capsular contracture, which is a scar capsule that your body makes that can squeeze the implant and make the implant look visible and be hard and not natural appearing or feeling. And the important thing is to go back to your surgeon and to discuss this. There are options that are available, but it depends on what is actually going on. And you could, if you're concerned about going back to your surgeon, then you certainly can go and request a second opinion somewhere.
Okay, yeah, it sounded, I don't know if Tammy's still with us, but it sounded like she had some concerns about that. But
Yeah.
that's not all that uncommon?
No.
People should know this.
Capsular contracture is one of the most common risks associated with breast augmentation surgery.
You know, all you have to do is go on the internet and you say
you'll see it.
good, bad, and the ugly plastic surgery.
But again, if you're, choose a plastic surgeon who is certified by the American Board of Plastic Surgery.
Okay, we need to take a quick break, but for more information about Dr. Elizabeth Lee, you can call her 510-704-2170 or check her out on the web at artfulsurgery.com. And when we come back on Body Beautiful, we'll continue our chat about safety in plastic surgery. Plus, we'll take your calls.